Hello everyone. First of all, thanks for giving me this opportunity to introduce my team. My team name is Hackathon and my problem statement ID is 25083. My problem statement title is Digital Health Record Management System for Migrant Worker Kerala. The theme is Healthcare and Wellness. PS category is Software. Team ID is 90239. My problem is especially designed for migrant worker in Kerala. Imagine being a worker moving from one city to another. Every time you visit a clinic, you are asked about your past medical history, but you do not carry your health record with you. Tests get repeated, vaccinations are missed, and treatment is delayed. That is the challenges we want to solve. Basic problem statement idea is migrant worker is Kerala often move between district or even state. Depend on small clinics where recorded are still paper based. The third one is lose track of vaccination and follow up. And fourth one is face language barriers. The example is the real world example we are imagine is a migrant worker name is Ravi who moved from Odisha to Kerala has already taken a tetanus shot in his hometown, but since he had no record in Kerala clinic gave him the same injection again. This wasted resource and more importantly delayed the actual treatment he needed. So the next slide is proposed solution. So the proposed solution, our solution is a digital health record management system called Care Vault. We will talk about the key features of the proposed solution is unique worker ID and QR code. Every worker has QR that doctor can scan to instantly access record. The second point is offline first system. Data can be entered without internet and scanned later. Multi-language support available in Hindi, Bengali, Odia and Malayalam. And secure storage. The last point but not the least is secure storage with AES encryption and compliance with privacy standard. And we are talk about the technical approach is front end. Front end basically in React and Flutter. Back end where we use fast API, Node.js. Databases we use PostgreSQL, Redis. Security we use AEI encryption, JWT auth, and interop we use FHIR plus ICD mapping. We talk about impact and the benefits, and we will talk all this impact and the benefits in division of area, benefit and impact, and how it arises in the system. The first one is public health and disease control, and the benefit and impact is improved surveillance and early detection of infectious disease. And how it rises in the system, we are centralized digital record, flagged symptoms, test result for infectious disease. For example, TB, malaria, COVID, etc. can be identified faster, enabling quicker contact tracking and outbreak responses. The second point is continuity and quality of care, and the impact and the benefit is better continuity. When again we are talk about impact and the benefits, and we are division of this table is area, benefit, impact, how it arises in this system. First area is public health and disease control. Benefit is improved surveillance and early detection of infectious disease. And how it arises in the system, we are centralized digital record, flagged symptom, test result of infectious disease. For example is TB, malaria, COVID, etc. can be identified faster, enabling quicker contact tracking and outbreak responses. And the impact is reduced diseases transmission. And how it arises in this system is migrant worker often move between district of state. Portable health data, for example, is vaccination, testing can help in secure, timely treatment and avoid delay that Warren Street. And the second area is continuity and quality of care. The benefit is better continuity when migrant move. And how it arises in this system, record travel with the individual, no need to render diagnostic or guess previous treatments. This improves healthcare efficiency and avoid duplication of tests. And the impact is improved treatment outcomes. More complete medical history means provider can make better decisions, reducing adverse interaction, misdiagnosis. The example of impact and benefit is during the COVID-19 pandemic, workers with digital vaccination record were able to prove their status quickly and get priority in jobs that acquired vaccination. This improved both their livelihood and community safety. So now we talk about research and references. Research area, we talk about the research areas. So the first one is digital literacy and engagement, and the description is despite high smartphone ownership, migrant workers often show low engagement in healthcare specific technology. The DHR must be user friendly, multilingual and require minimal digital skill for basic use. And the second one is language and the communication, and the description is DHR interface must be available in the native languages of the migrant population. For example is Hindi, Bengali, Malayalam, Odisha. So now we talk about challenges and the solution. Of course, there are challenges. First one is resistance to digitalization. Some clinics will still prefer papers. The second point is privacy concerns. Worker fear misuse of data. Affordability. Smaller clinics may find cost high. Our strategies: easy onboarding with tutorial in local languages. The second point is free trial version of clinics. And the last but not the least is strong encryption to ensure data security and the privacy. And the last slide is the conclusion of this problem. In short, digital health records for migrant workers are not just a tech solution. They are a way to give dignity, safety and better healthcare to people who need it most. With systems like Care Vault, we can make healthcare portable, secure and inclusive. Thank you.